Can I get the popcorn?
Hi everyone. Thank you for being here today. My grandmother has lots of jokes already. So I have you all here today to talk about breastfeeding, as it is a part of my life. So imagine giving birth to a baby, or if you are a male, imagine your child being born. In that moment, you are filled with joy, and all you can think about are the needs of that baby and wanting only the best for him or her. Breastfeeding falls into that category. I look around and I see we have mothers, fathers, grandfathers, grandmothers, and even aunts and uncles. At some point in time, I'm sure that you held a baby of your own or one that was close enough to it. According to the Center of Disease and Control Prevention, 83.2% of babies are breastfed at birth. I myself am part of this statistic. I'm a mother of 3 and I have exclusively breastfed my 2 oldest sons, as well as I am currently breastfeeding my youngest son, who is 3 months old. Breastfeeding benefits the mother and infant in many ways. Breastfeeding allows the baby to have reduced risk of viruses, lessens the risk of SIDS, and allows the mother to return to her pre-pregnancy weight at an earlier time. The first topic we're going to discuss is the reduction of viruses. According to Dr. Ruth A. Lawrence, a professor of pediatrics and OBGYN at the University of Rochester School of Medicine, and is also the author of Breastfeeding, a guide for medical profession, states that breastfeeding reduces the risk of viruses, urinary tract infections, ear infections, and respiratory infections. There's nothing else worse than having a sick infant, and there's nothing much you can do because they are so young. If you think about it, breast milk works as a medicine. It's providing the child with the necessary nutrients it needs to fight and to build a strong immune system. I hope I don't jinx myself by saying this, but none of my children have ever had an ear infection. So now that we've talked about the risk of viruses when a child is breastfed, let's talk a little bit about SIDS. SIDS, or sudden infant death syndrome, is defined as the death of a seemingly healthy infant. SIDS usually occurs during a period of sleep for that infant. According to Dr. Jody R. Duncan, 95% of SIDS occurs within the first 6 months of that infant's life. As a parent myself, this is my biggest fear, losing my precious baby to a cause that's unknown. I take pride in knowing I'm able to nurse my babies and reduce several risks that come with being an infant. The next topic we're going to discuss will be the earlier return to your pre-pregnancy weight. One of the hardest things for a new mother is to lose weight after giving birth. Most women gain several pounds and their bodies are going through so many changes. After all, a human being just came from your womb. With breastfeeding, a mother is able to return to her pre-pregnancy weight at a much faster rate. I don't intend to stand here and glorify breastfeeding because the truth is, while it's very beneficial, there's a not so pretty side that many don't see. Like the fact that your breast will increase, making it hard for you to find proper support. Or the fact that if you do not take your prenatal vitamins, your teeth can become very sensitive and fragile. Not to mention your hair loss and the new growth that comes with it as your hair begins to grow back. To wrap everything up, the benefits of breastfeeding are extremely favorable for the mother and child's health. As you can see, I have a healthy little baby right here. And at 2 months old, he was the size of a 4-month-old. So not only does breastfeeding help the mother and child, but it also increases their squishiness, their body fat percentages, and this guy is in the 99 percentile for everything that is actually. So thank you guys for all coming, and I appreciate you.